One of the most important things about type 2 diabetes is you, the patient, has to take control of the disease. One of the ways that you can take control is to know exactly what your own blood sugar is and to measure your own blood sugar. There is some controversy about the effectiveness of measuring your blood sugar, but I'd like to divide these reasons up into three groups. First of all, a person who is newly diagnosed with diabetes. The person who's newly diagnosed should be starting on a diet, should be starting regular physical activity, and should be learning what the various foods do to their blood sugar when they eat a meal. So a newly diagnosed patient for at least 6 months, perhaps a year, should test their blood sugars on occasion in the fasting state, 2 hours after eating, which by then should be back to less than 10, or at varying times, for example, bedtime. There's no set regimen to testing frequency, but you should learn what your diet does to you, you should learn what exercise does, and you should learn how well you're doing as far as approaching your goal blood sugar levels. You know you have to have a fasting sugar that's less than 7, and 2 hours after eating, your blood sugar should probably be less than 10. So those are the goals, and that's what you would measure when you first are diagnosed. The second group of people is those who are started on a medication, but a medication that doesn't cause hypoglycemia. For more information on that, I would refer you to our medication module. However, in general, if you're taking a medication other than, that does not include sulfonylureas or insulin, in other words, medication that doesn't produce hypoglycemia, you would probably want to test your blood sugar before eating and episodically, that is, before lunch or before supper or before bed, at least once or twice a week. And you might on occasion also test 2 hours after a meal. You would then learn, has my medication brought me down to goal levels? Finally, the third group are people who are taking a medicine that causes a too low blood sugar or hypoglycemia. This is certainly the case with insulin, but it's also true with the sulfonylureas. Therefore, a person who is taking a sulfonylurea or insulin should certainly check before meal, would often need to check after 2 hours after a meal or 3 hours after a meal. They would need to check when they've done particularly heavy exertion or physical activity, and they would certainly want to check when they feel any symptom of hypoglycemia or excessive low blood sugar. So such individuals would have to check their blood sugar on a continuing basis at least 1 to 3 times a day to get the proper control. So testing blood sugar varies depending upon whether you're new to the disease or you've had it a long time, whether you're taking new medication, or whether you're taking a new lifestyle, changing your lifestyle, and finally, if you're taking medication that produces an excessive low blood sugar. Don't stop checking, however, at least on occasion, because you have to control your diabetes and you have to know where you are in your own control.